Hello, good afternoon, friends. I'm back again Thursday afternoon with my Facebook Live. Uh, Today, I would like to speak to you on a very sensitive topic for all my pregnant mothers, and that is about painless labor. Okay, so I have seen in my OPD that as soon as the patient checks in for the first appointment for a pregnancy, the first thing that the patient always tells me is, "Ki ma'am, we want a normal delivery. Whatever happens, we want a normal delivery, and please tell us what we need to do to have this normal delivery." Because it is, um, very sort of a norm that everybody comes in with this request, and if there is a mother-in-law or an elder in the family who comes in simultaneously with the patient, they will also come in with the same request saying that, ma'am, make sure that she has a normal delivery. So I always tell them, I said, look, normal delivery is not in my hands. Normal delivery is not a choice. Normal delivery, we'll do everything to ensure that this patient has a normal delivery, but it is not sure, it's not 100%. The entire course of the pregnancy involves so many things. There can be medical conditions, there can be problems with the baby, there can be emergencies, there can be so many things which will mandate an emergency cesarean, or the location of the placenta may be such that it is obstructing the delivery of the baby. There may be a large fibroid which is sitting in the lower segment of the uterus which is obstructing the delivery of the baby. So there are so many 101 reasons for a patient to have a cesarean. So at the first visit, I cannot say ki patient will have a normal delivery or not. It always is as we go through the course of the pregnancy. As we reach the end of the pregnancy, say after about 37 weeks, when we actually do a pelvic assessment, where we assess the size of the pelvis of the lady and see whether that pelvis is adequate to push out the baby or not, that is the time we give them a sort of idea that yes, you are good to go for a normal delivery, but still there is no 100% guarantee for a normal delivery, because things can go wrong in labor at the last minute also, which might mandate a cesarean. So like I said, so I've just diverted from the topic actually. So like I said, patients will come in and they will say that we want to have a normal delivery. But by the time the patient reaches about 34 weeks of pregnancy, that is, say, around 8 months of pregnancy, and the anxiety of the delivery starts setting in. And then, of course, there is Google is God. So Google gives you a lot of information. Google gives you a lot of videos, Hindi movies, and elder people in the family and friends and every peer pressure, whatever. Everybody tells you that it is horrible to have a normal labor. The pain is too intense. It is going to be too painful. It is safer, better to go just quietly, get a cesarean done and come. So I have patients who come to me and tell me, ki, ma'am, kuch bhi karo, but I don't want this normal delivery. I want a cesarean. And don't tell my family, I want a cesarean. Make some indication and do a cesarean. So that is the time I actually sit down with the patient and ask the patient, why? What is your reason for asking for a cesarean? And most of the time, the reason for asking for a cesarean is pain. Ki bhai, we have heard that normal delivery involves intense pain and I am not able to take that pain. So the husband is also bichara sitting by the side and saying, ki, nahi ma'am, I know her, she will not be able to take this much pain. I think you should do a cesarean. So again, boils down to the same thing, that pain becomes one of the main reasons why patients actually back out of a normal delivery or are so non-motivated for a normal delivery. But now if I sit here and I tell the patient that, look, please do take a try for normal delivery, I assure you that there will be zero pain. There will be no pain. Right? From the beginning of labor till the end of labor, till you push out your baby, till we stitch in your episiotomy, there will be no pain. If I say that, will all these ladies be ready to accept a normal delivery? Yes. And that is what I want to speak to all of you about today. That there was a time when labor pain was considered to be, something that a woman always did. Her power, her superpower was judged on the basis of whether she took the pains and had a normal delivery or not, But that is stupid. That is really stupid. If you're going to take a pill for a headache, if you're going to take a pill for a backache, if you're going to take a pill for a stomach ache, labor pain is one of the most intense pains or one of the highest level of pains existing on earth today. Why not, if there is an option to relieve that pain, use it? right? Why should you want to be that martyr lady or that superwoman lady and take that pain to have a normal delivery? The baby is going to anyway call you mama, whether you take that pain or you don't take that pain. If you deliver that baby, whether normal, whether by cesarean, whether painful, whether painless, the baby is still going to be yours. The baby is still going to call you mama only, na? So why take that pain? Okay. So today I'm going to talk to you about how a painless delivery happens. Okay. Now, lots of people will tell you a lot of things, do breathing exercises, you do this, very good. All those things are very good. See, you should understand that every woman has a different level of pain tolerance, right? My level of pain tolerance may be only this much, कि जरा सा कुछ एक चींटी ने भी काटा तो भी I will sit and hold that hand and say, oh God, the cheetah has bitten me. Okay, but there may be women whose pain tolerance is very good, right? So they can tolerate intense amounts of pain very normally without feeling or without bearing them. So everybody's pain tolerance is different. So depending on the pain tolerance of the women, we can always give an option of different kinds of labor analgesia or painless labor. So painless labor may there are injections and medicines which can alleviate the pain to a certain extent. There are inhalational drugs which the woman can inhale intermittently to alleviate her pain. Basically it is laughing gas. Okay, laughing gas you inhale these which may, and the pain gets alleviated. And then the best thing these days available for painless labor is an epidural. Okay, so remember that any intravenous drug or any of those IV injections or any of those inhalational anesthetics that we use will in some amount pass to your baby through the placenta. But epidural is one such method of painless delivery where there is no drug that actually passes to your baby through the placenta. Why? I'll tell you why. Epidural basically is a method of pain relief in labor in which there is a small thin hair size cannula which is injected into the back of the lady near the spinal cord, not at the spinal cord, not touching the spinal cord. The spinal cord has a cover and a second layer of cover. So between these two covers, the drug is injected and left. And this is the area where there are all the pain fibers that cause the pain of labor that lie. So when you inject the drug between the two layers of the membrane of the spinal cord, obviously there is no drug that is directly passing through the placenta to your fetus, right? And at the same time, there is the drug that is lying there through a thin cannula, and that drug gets absorbed in that area by those nerves, and it completely alleviates your pain of labor. Zero, right? So I'm saying zero. For me, it may be zero because my pain tolerance is good, but it definitely brings down your pain to an extent that you can tolerate it, right? So if the pain score is 100, we can say epidural will take away almost 90% of that pain. And you will have to take only that 10% of the pain of labor, which is nothing, which is like a menstrual, probably even lesser than a menstrual cramp, or just a mild discomfort, not even a cramp. It is a discomfort that you will probably feel with the contraction in labor. Okay, so it is that good. That epidural analgesia is that good. Okay. So women are scared, कि पीठ में इंजेक्शन लगेगा, पीठ में एक ट्यूब डालेंगे और उस ट्यूब से हम intermittently दवाई डालते रहेंगे so that the effect of the analgesia keeps spreading and we can maintain the pain relief in labor till the patient delivers, right? You are very scared कि पीठ में, but believe me, it is in the hands of a very good anesthesiologist, it is a very, very safe method of analgesia. It can be given at any time in labor. As soon as you start feeling that this pain is now getting intolerable and I'm not going to be able to take this anymore, you can ask for an epidural. It can be given to you. It takes only 15 minutes to instill a cannula there and give you complete pain relief. And as soon as the cannula goes in, the pain of labor completely stops. Okay, so you can take it at any stage in labor. Whenever you feel कि भाई अब हो गया, अब मुझे नहीं करना और, you can take the epidural, get your pain relieved, and continue your labor so that you have a normal delivery. The chances of a normal delivery increase. Now, also, One reason for cesarean most of the times is the pain. The patient is not able to take the pain. Doctor, मेरा cesarean कर दो, मेरा cesarean कर दो, please मेरा cesarean कर दो, है ना? डॉक्टर बेचारा रो रो करके, नहीं, मदर इन लॉ सब खड़े हो जाते हैं, cesarean कर दो, इसको दर्द नहीं बर्दाश्त, and we have to do a cesarean. But if you can tolerate that pain, and if that pain goes away, then I'm sure that all of you would like to take that trial for a normal delivery. Then what happens is that once the pain goes away, the mother is relaxed, right? She's breathing easily, she's relaxed, she's comfortable. So because of that, the oxygen supply and the blood supply to the baby is maintained, getting better. So the baby does not go into any kind of fetal distress, right? So that is another good point of an epidural. Third is that there are some women, see, aajkal ke zamane mein na, honestly, we don't squat. Right? In our olden days, our mothers and all, they used to, cook on a chula. They used to work in the field. They used to, wash clothes squatting. So there used to be so much squatting work that they used to do. So their pelvises, their pelvic muscles were very relaxed, very open, right? But हम क्या करते हैं? हम तो टॉयलेट भी कुर्सी पे बैठते हैं, है कि नहीं? तो हम तो वहां भी स्क्वाट नहीं करते हैं. So because of the lack of squatting that we do, we constantly sitting on a chair, we're not even sitting on the ground. पुराने जमाने में तो खाना भी बैठ के खाते थे, नीचे आलती पालती मार के. आजकल कौन खाता है? डाइनिंग टेबल पे खाते हैं सब लोग, है ना? So there is no squatting. Because of this no squatting, the pelvises, the muscles of the pelvis are very tight and very rigid, right? So the process of delivery, where the baby has to negotiate all these tight muscles and then come out into this world, is going to be very long if the muscles are very tight and rigid. What epidural does is it relaxes all these muscles. ये सारे जो नीचे tight muscles हैं, इन सबको ढीला कर देता है, relax कर देता है, chill कर देता है. जब ये सारे muscles chill हो जाते हैं, then the passage of the baby's head through the pelvis becomes much smoother, easier, and faster. So remember, your duration of labor also will become slightly shorter if you can use an epidural. Okay, so I've told you 3 advantages, and the biggest is no pain. Okay, no pain. One. Second is that because there is no tension in the mother, she's not hyperventilating, she's not screaming in pain, she's not rolling in pain, she's more relaxed. So the baby is getting more oxygen, the baby is getting more blood supply, so the baby is also happy inside, right, coming through labor. Third, the muscles of the perineum also relax, so the baby is able to come down easily, and the duration of the labor also may get shorter. Fourth advantage, once the baby is delivered and once the baby comes out, right, we normally give an episiotomy or a cut on the perineum to deliver this baby. And why we give that cut? Lots of patients come and ask me, doc, we don't want to have this episiotomy. But I always tell them that supposing I don't give you the episiotomy and there is a tear because of the pressure of the baby's head, then that tear may directly go into your rectum or your portica rasta. And once it goes into your portica rasta, it may just open or tear your portica rasta, causing a huge problem, repair of that portica rasta and everything and all that. But if I give a small cut, a predetermined cut on the perineum, then that extension or that perineal tear does not happen. And that neat cut that I have given can be easily repaired, and it heals also faster. So post-delivery, once the baby is out and the placenta is out, then I have to repair that cut that I have given. So if you are under epidural, then you don't feel the pain of the cut, you don't feel the pain of the repair also, right? So nothing happens. So that is the fourth thing that is advantageous, that your episiotomy repair is very relaxed and very easy. While you're holding your baby, trying to feed your baby and enjoying your baby, I have repaired your perineum from below without any pain. Right? Now, there are so many situations where, the placenta may get retained, or there may be some emergency post-delivery after the baby is delivered, for which I may need to intervene or do some manual interventions, right? If you're under epidural, you won't feel those manual interventions. Also, they will be pain-free for you. They will be relaxed for you. And I will also be able to do my job much quicker and faster, because a patient who's keeping her perineum tight and who's screaming and shouting makes my job also more difficult. But if you're relaxed and if you allow me to do what I have to do, obviously what task is going to take 10 minutes will take just 2 minutes to finish. Right? So that is another advantage of the epidural. So I have told you so many advantages of the epidural. Fifth advantage. One more advantage of the epidural is that supposing you're in labor and suddenly, because of some reason, your baby lands up into a distress. The baby's heartbeat starts dropping drastically, and I have to pull this baby out quickly. Otherwise, something will happen. Otherwise, this baby will have hypooxygenated and may have to go into the nursery and some breathing difficulty and all that. Supposing there is an emergency for which I have to remove this baby. I do not need to give another anesthesia. I can do your cesarean and pull out this baby within 10 minutes. Within 10 minutes under an epidural itself. Okay, so that is another advantage. Otherwise, supposing you have not taken the epidural and there is a fetal distress, then what will happen is everybody is running. They're running to the OT. Then after that, the anesthetist is trying to give you the anesthesia, and then we are trying to remove your baby. So that entire process takes about 25 minutes. Okay, but if you're already under the epidural, the shifting from the labor room to the OT is the only time that will take. Baki pulling out his baby quickly in 2 minutes is so easy because we don't have to give another anesthesia. You can have your cesarean also under epidural analgesia. This is another advantage. Okay, so for all those high risk mothers where we are giving trials of labor, कई बार ऐसे होता है ना कि हमें लगता है कि यार क्या पता हो जाए डिलीवर अगर हम ट्राई करें इसको नॉर्मल करने की. तो in those situations, if we have taken an epidural and God forbid at the last minute we have to move you for a cesarean, then we can quickly pull out this baby without a problem. So that is very, 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 very advantageous and very, very good. Okay, so that is another advantage. Then there is no real effect on the baby. No drug that is passed to the baby. So baby comes out happy, crying without a problem. So now I have told you so many advantages of this epidural analgesia that can happen if you take the epidural, right? So remember, pain-free, right? Relaxed mother, so better oxygenation to the baby. Relaxed perineal muscles, so smoother delivery. Stitching up of the episiotomy is easier without pain. If there is any manual intervention required, it is easier done. Sixth is, if there is sudden fetal distress and I have to pull out this baby in emergency, it takes no time. Quickly the baby can come out. Seventh advantage is that once the epidural catheter is in place, we can leave it inside for 48 hours. So supposing there is a difficult episiotomy that has been stitched, which I know will cause the patient a lot of pain, right? For 1 or 2 days after the suturing or a cesarean has been done, I can leave that epidural in and you can have that pain free for the next 24 to 48 hours. We remove the epidural only just before 6 hours before discharge. By then, most of your pain has already gone and you are on oral painkillers. So no pain that way also. Okay, so post-operative or post-surgical or post-episiotomy pain can also be taken care of with the epidural. So see, 7 advantages of the epidural I have straight away told you. Okay, but then obviously it is a procedure, so there can be risks, there can be complications, and there can be cons also. There are pros to, there are cons also to something. Okay, now what are the cons? One, the first con is that patient is not willing to take the anesthesia. We cannot give it. Till you give your consent, we cannot give an epidural. Second, when we are giving an epidural, right, now we are talking about the drug being injected between the 2 layers of the dura, right? 2 layers के बीच में. Supposing inadvertently this dura has punctured, right? It becomes a spinal anesthesia, right? So if it becomes a spinal anesthesia, then it is a problem. We may need to convert this into a cesarean, right? So that is one disadvantage. But I have been using epidurals on my patients for almost 10 years, 10, 11 years, and more, 15 years now. And I have yet to see any epidural getting converted suddenly into a spinal. No, it is a very safe procedure, very, very safe procedure. Doesn't happen. But yes, I am telling you this, that it can happen. And if it happens, we will tell you that, look, this has happened. And for you, this is the safer option. So let's go. That is one. Second, the effect of the epidural may not be as good as it normally is supposed to be. Maybe a patchy effect. So if there is a patchy effect, what we can do is we can adjust the placement of the epidural catheter and reinstill the drug so that you are more comfortable. Or we can institute some other methods of analgesia along with this patchy epidural so that you are more comfortable, right? Third, because of the epidural and absolute lack of pain, sometimes the pushing sensation that the mother should get to push the baby out may not be there. Okay, so at the time of full dilatation, when the mouth of the uterus is completely open and the baby needs to be pushed out, by force, the maternal effort is missing because the mother does not feel that sensation, that potty like sensation that actually makes the mother push. That sensation is completely absent. So, to pull out this baby, we may need to use a Ventouse cup. Now, a simpler explanation of the Ventouse cup is Three Idiots. Three Idiots made that cup that they made and they pulled the baby out. That is a Ventouse cup. But of course, it is not as crude as or crudely done as it was done in that movie. It is a more sophisticated, steady equipment where very safely we can use a Ventouse cup and gently pull out this baby without injuring or traumatizing the baby. So application of a ventouse is a very simple procedure. It may need to be done if the patient is in epidural and she's not able to push that baby out, or if there is no maternal effort, right? And usually, because the perineum is very relaxed at that time under epidural, the mother does not feel any pain, and the pulling out or the application of the ventouse is also very easy. Okay, so that may be one that we may need to use a ventouse. But most of the time, what I do is that when the patient is just almost fully dilated, na, we stop the epidural. एक बार हम epidural stop कर देते हैं, तो the pain doesn't come back, but the sensation of heaviness comes back. And sometimes that sensation of heaviness is enough for the mother to feel the need to push the baby out. So again, I'm saying out of 100 deliveries under epidural, maybe about 20 will require a ventouse application. The other 80 will deliver spontaneously without a ventouse application. Okay, so these are the cons. One more disadvantage of an epidural is that once we give an epidural, sometimes the mother may have a fall in the BP, so she might feel a little dizzy or a little itchy all over the body, and that effect lasts for about 15 to 20 minutes. So now those 15 to 20 minutes, she may be a little uncomfortable, and we may need to give her little fluids, IV fluids and all that to make her comfortable. So these are just the simple disadvantages of an epidural. Of course, there are a lot many complications that are written in your book, but then which procedure does not have any complication? Every procedure has its own share of complications, and if they are written in the book, they have happened, but doesn't mean that they will happen again. So we have to always look at the incidence, that how many patients actually had this complication. So if in 10,000 patients only one patient had a complication, we don't really consider it as much. So it's not a disadvantage. Okay, so I have told you so many advantages of an epidural, and I have told you some disadvantages also. But I would request you to please come and discuss this with your obstetrician, the doctor who's going to be doing your delivery around 34, 35 weeks of pregnancy, when that anxiety of pain starts popping up in your head. Please come and discuss the option of epidural with your doctor. So what we will do is we will explain to you what the epidural is. We will also send you to the anesthesiologist to understand how it is done, what are the problems, complications, how do we manage an epidural, so that when you are in labor, you don't have to think too much, and whenever you want to take that decision for epidural, it is in your hands and you can make that choice. Supposing you have not discussed this before with us, and you come straight in labor, and then you don't know what an epidural is, and at that time you're in so much pain and so much discomfort that nothing goes into your brain at all, and then everything goes hodgepodge and goes for a mess. So please remember to discuss the option of epidural at around 34-35 weeks with your obstetrician. I try to remember to discuss it with my patients, but sometimes I'm a little old lady, so I sometimes forget to discuss. But every one of you should come and discuss this option with your obstetrician, so that they can tell you more about this procedure, more in detail about this procedure, and all of you can have a very safe, very happy, very painless, very healthy, and wonderful delivery with this procedure. And I feel that because pain is one of the reasons for cesarean, lots of women will deliver vaginally if they use it. Okay, guys. So this is all I wanted to tell you about painless labor today. I think I have done most of it, and we are already, at closing time. So if there are any questions, one or two questions I would like to take. Any questions? Shubham. Okay, she's about to deliver. Please suggest some ways to manage labor. Oh my God, manage labor, your obstetrician is supposed to do. You are not supposed to manage labor. Please take her to your doctor. Talk to your doctor. She will tell you how to manage that labor. Shubham, how will you manage labor? You're not going to deliver her, no? You're just going to hold her hand and stand. That's about all. Yeah? But epidural may be a good choice if she's going in for a normal delivery. So discuss painless labor with your doctor and make sure she does. Thank you so much, Angel. Thank you so much. Thank you so much. I'm glad you understood it and liked it. And I hope all women use epidural. When I delivered my baby, there was no epidural at that time. And don't even ask. I brought the house down. Oh, thank you so much, Angel. That is so cute of you. That is so nice of you. Really nice of you to say that. Thank you so much. Rupali. Oh, thank you, Rupali. Thank you so much. I know this is very important. This is very, very important, and doctors generally forget to discuss this with their patients. They're so busy in the OPD, sometimes it just slips out of our mind. It's not our fault. But please ask us about it, and we will tell you. It's like that. Yes, Meher, this is what I have been talking about all the time. It is possible to have painless labor contractions, completely painless labor. No pain at all with the epidural. Please, when you go in for your delivery, ask your doctor to give you the epidural so that it works for you. Okay? Thank you so much, everybody, and I'll be back again next Thursday. Please put in the topics that you would like me to discuss with you so that I can, see if I can talk about some of those. Thank you. See you. Bye bye.